Good afternoon, all. Thank you so much for joining in for today's Acchutha INSPIRE Series. And without much delay, I would like to invite our speaker for today. Before handing over the session to her, thank you so much for joining in today, Dr. Aiswaryah. Dr. Aiswaryah did her bachelor's in optometry from Chennai and continued her master's MPhil in optometry from Chennai as well. Further, she did her PhD in optometry from Spanish Research National Research Council University in Madrid, and she also has a postdoc experience from IIT Madras. She has been associated with SRM University for the last over 8 years, I believe. And today she's going to talk about eye movements, how important it is as an optometrist. We should know about eye movements with respect to diagnosis and research. Over to you, Dr. Aiswaryah. Thank you so much for joining in. The screen time is yours.
Thank you, Gopi. I'll just share my screen. Okay, we are good to go, right? Okay, Gopi, thanks. So I'll be talking a bit about what eye movements are, and in this time, what I could do, I hope I do justice to it. So the topic I have chosen is eye movements and how we can use it, not only for ocular assessment, but also for assessments that goes just beyond it.
Ma'am, it has been muted.
Yeah, you're muted. Yeah, you're still muted.
Is it good now?
Yeah, I think, yeah, it's good now.
Okay.
Thank you.
So I don't know why that happened. Which is so these are the aspects I'll be covering in today's talk. So what is eye movements? Why is it important? And what are the various types of eye movements? Where does eye movements originate? And what are the certain terminologies that are associated with it? How is it measured in experimental setups using web-based setups and remote monitoring setups, as well as clinically? And its applications in systemic ocular and functional conditions, and what we here do with basic research at SRM. These are the aspects I'll be talking in today's session. So why eye movements is the first question, right? Everyone knows that we do eye movements. There are these extraocular muscles we have, and we make these levoversion, dextroversion. These are not the eye movements that I'm going to be talking about today. The eye movements I'm going to talk about are the movements that helps us look at a range of visual field. For example, this is a scene. This is a famous plaza here from San Piazza. And we see that this is a huge range, and our visual field spans about 120 to 130 degrees binocularly. However, because of the distribution of rods and cones, the region of interest or the region of fine vision in the eye is limited only to the central region. So this disproportionate distribution of the visual, the photoreceptors is what triggers the eye movements, and the eye movements help us enable inspection of certain areas or objects of interest by moving the fovea to these regions. So that's the purpose of eye movements. And these are either voluntary or involuntary movement of eyes that helps us track an object that is moving or to maintain a foveal vision. It also helps us shift focus from one object to other, and it also facilitates certain cognitive processes. Okay, so to give a example of what eye movements are, I have a series of animations here. I hope you can follow with me. So this is the first eye movement that I'm talking about. We have a ball here, and so please follow the ball from whichever instrument you're using, whichever device you're using. Please use your eyes to move the ball. So this ball is making a slow movement. It is going from one side to the other. This is one kind of eye movement. The second one is I have a ball here that's going to change its position, right? It's going to change its position. And I still want you to please move your eyes to look at these balls. Okay, that's the second one. We have the third one. Now here I want you all to keep fixating at the TV here and then move our head like how this man does. Just keep fixating at the TV and just move your head. That's the third type of eye movement. The last one is something we are all familiar with, which is the convergence, which we routinely test in the clinic. So the movement of the eye when the object distance changes. So these are the four basic types of eye movements. The smooth pursuits, which slowly helps in tracking an object that is moving at a certain speed to maintain that object on the fovea. That is your pursuit. The second one, where we change fixation from one tennis ball to the other, the rapid abrupt change in fixation is called as saccades. The third one, where the head is moved, but we maintain looking at an object in front in the external environment, that is called the vestibular ocular movement. So this helps us to essentially stabilize irrespective of our eye movement or while walking or while climbing stairs, irrespective of our head movement or the eye movement, the fixation is maintained on a specific one to have a spatial stability of the external world. And finally, we have vergence, which helps alignment of object in both eyes fovea, irrespective of whatever distance the target is. So these are the four main types of eye movements. And the fifth one, which is of much smaller magnitude, is called the fixational eye movements, which are tremors, microsaccades, and drifts. These are movements which happens while we are maintaining a fixation in between, while we are looking at an object, because this helps us to maintain or prevent perceptual fading. So these are the 5 types of eye movements. So again, pursuits are voluntary movement. These have a linear relationship with the target. And whenever a pursuit is measured, it can happen in an open or closed loop. So open loop is for beginning of the pursuit initiation. So irrespective of where your target is, within 100 milliseconds, the eye has to have a point of interest. So the open circuitry of the pursuit happens at the first 100 milliseconds. And there is a closed pursuit which starts tracking the object. So this is pursuit, and it works for slower object tracking, that is up to 30 degree per second of velocity. So pursuit measurement requires target properties. There cannot be any voluntary pursuits without having a target. However, this can be trained. If one tries to do a voluntary pursuit without a target, it looks more like um, a jerky saccade rather than a pursuit. So there cannot be any smooth movement of the eye without a target. And if at all that is there, it has to be trained. We are not naturally made that way. The second set of movements we saw are saccades. So the saccades are ballistic. What do we mean by ballistic movements? Once a saccade starts, the position and the amplitude of the direction and the amplitude of saccade is fixed. It cannot change or it cannot correct as per the target. Whatever correction has to happen will happen in a secondary saccade. So saccades are ballistic movement, and we can see here you have a target that changes an abrupt. Move to the laser pointer. So we have a target here that has an abrupt change, and the saccades goes in the same direction, and any correction to bring it back happens in a secondary saccade. So saccades can be small, like when we read or when we use a smaller digital device, to large when we are doing any activities of daily living, like walking while watching a football match or while driving. the velocity changes with amplitude. The larger the amplitude, you have to make faster eye movements. Thus, the velocity changes with the amplitude of the movement. Saccades can be voluntary, it can be reflexive, and saccades are also found to happen during rapid eye movements. So microsaccades are saccades that have much smaller amplitude, which is less than 1 degree. Next is the vestibular movement. The vestibular movement is essentially a reflex response. What happens when the head moves? What happens when you have a response that is reflexive? To prevent the slipping of the image from the fovea, we have a reflexive movement, and this essentially has the same amplitude but of opposite direction. So whichever direction the head moves, you have the same magnitude but opposite direction of movement in the eye. And these are much slower than the vestibular responses. Again, for a vestibular ocular movement to happen, one requires a visual information. Vestibular ocular, the eye moves even when you close your head and you're moving, the eye still moves, but the magnitude of change is much smaller and it is not considered as a typical vestibular ocular movement. Next, we have the fixational eye movements. These are very small movements. This helps in exploration for small objects which are stationary, and it prevents perceptual fading. So we have three types of movements under this. First one is the tremor, which is pretty much similar to a physiological nystagmus, but it is not periodic. It has the period varies, and it is of very high frequency. The next one is the microsaccade. The microsaccade is again very small, extremely fast, jerky movement. It has a low frequency and the amplitude is also much, much smaller. And finally, we have drift. Drift is a very low frequency movement. The drift is actually of varying phases. It can be of it need not have a specific direction. The phase can also change. So these are the three types of fixational eye movements which requires very good high frequency eye tracking setups to measure. Okay, so where does all this start? Almost all the eye movements, the important center for it is the superior colliculus, but it all starts from much earlier. We have the frontal eye field, which receives the information from the visual field, which then moves it to the crus cerebri and the corticotactile tract, which then moves it on to the midbrain towards the superior colliculus. And then the information is conveyed from the superior colliculus to the inferior colliculus. Essentially, it is at this level, the amplitude and the direction of motion is computed, which is why the superior colliculus and the inferior colliculus parameters are, the apparatus is considered very essential for eye movement. And from here, it goes on to the parietal region, where for the vertical gaze, it goes on to the midbrain reticular formation, and for the horizontal gaze, it goes to the pyramid and pontine reticular formation. From here, it goes to the abducens, the trochlea, and the oculomotor nerves. So this is the pathway for the voluntary saccades. When we have reflexive saccades, the initiation of reflex happens from the substantia nigra, and then it goes to the superior colliculus and follows the same circuitry. So this is the response for the saccades. And pursuits, it starts from the temporal eye field. From the temporal eye field, it goes either to the frontal eye field or to the dorsolateral pontine nucleus, both of which takes the information to the contralateral cerebellum. From here, it goes on to the vestibular nuclei, and this is also the pathway for the vestibular ocular reflexes, from where it goes on to the vertical and the horizontal gaze centers. Now, when does all this start? Most eye movements are present at 1 month, except for the pursuits. So at 1 month, we have saccades, which are inaccurate, which are slow, but they are still present. The vestibular ocular reflex is present. also inaccurate and slow, but they are still present. So when we hold a child, even if it is not fixating, if you move its head, the eyes are going to change its direction with respect to the head movement. And then the optokinetic nystagmus is also present, but it is asymmetric. The movement towards the nasal direction happens more accurate than the movement towards the temporal direction. And pursuits are not present at 0 to 1 month of age. Between 2 to 4 months or 2 to 5 months is where most of the eye movements improve. So the saccadic accuracy, the accuracy of the vestibular reflex system improves over here. The optokinetic nystagmus becomes more and more symmetric, and this is when the pursuits begin. The pursuits are still not fully established at this stage, but the children can start looking at light and follow a light which is much slower. The adult level saccades are actually established at 6 months' time. This is where adult level VOR and as well as OKN is seen, and pursuits also start developing very well here. And by the time a child is 1 year old, almost all of these eye movements are well established, and this goes on till their adolescence, early adolescence, until 12 to 15 years of age. The latency and the accuracy of these systems keep improving. And yes, I keep using these terminologies like latencies and accuracies. What these are, we'll see now. So when we look at a paper on eye movements, or when we look at any research on eye movements, these are terminologies we come across very frequently. But before we go on to that, I just want to explain what we have in this diagram. So we have a target graph here, a time versus movement response. What happens when there is a target movement? What happens to the eye movement? The first one we look for is the amplitude of the motion. A target which is present at 50° temporal to the foveal fixation. What degree of eye movement is made? Does the eye move to 50°, or is it moving to 30°? Is it overshooting or undershooting? Hypometric or hypermetric measurements. That is what the amplitude represents here. The next term is the latency. What is the delay in the initiation of eye movement? A target attains a peak amplitude at 500 milliseconds. What is the delay from the initiation to the beginning of eye movement? Pretty much similar to our VEPs. That is what we see here, the latency in eye movement. The third one is the length of eye movement. To what extent was the target present? To what extent are the eyes moving? That is the length of eye movement to attain a peak and coming back to its original position. So from these parameters, we have a velocity calculated, which is the amplitude versus the duration. We also have a gain of eye movements, which is target velocity. So the peak versus the time for the target versus the amplitude versus duration of the eye movement. So we have the gain in eye movement. And we also have acceleration. This is very important, especially when we have smoother movements like pursuits, where the initiation and the attainment of amplitude is happens as a slope. So this slope, it can either be very steep or it can be flat. A flatter slope of this indicates a slower acceleration. A steeper slope indicates a faster acceleration. So that is very helpful for understanding how fast it is initiated from the latency. And then we have directional measures, such as whether the saccade made is pro-saccade or anti-saccade, whether the direction is correct or wrong. So we also have direction-oriented outcomes, especially in terms of saccades. And then regressions. How many times do these eye movements have to come back to get a correction, either for amplitude or for direction. So regression is basically an error correction. So the number of regressions is what we usually have. And finally, these are used in certain types of eye movement outcomes: the area of interest, the heat map and the route map, or the heat map and the scan path. These are different terminologies which are again used, and these are not going to be very numeric, but these are very visual representation of what the eye movement behavior is in different aspects. So I hope these terminologies are clear. So this is an example of the heat map. I'm not able to play the video, just a minute. Yeah. Gopi, I'll just take a minute.
Sure, no problem.
Yeah.
Yeah.
So this is an example of the heat maps, and an example it is used in psychology, how simply the eye movements are made when someone is doing a memory exercise. So the region of interest is given in red to green, red to blue, red indicating maximum attention and blue indicating minimum attention. And we could see the way the eye moved while this happened. So this is a heat map or a route map. Okay, with all that, we move on to how the eye movements are measured, because most of the time, the eye movements we measure in the clinic, which is what I'm going to deal with in the end, are very simple. It's quite fast, but it is not assessing the terminologies that I just mentioned. It's not going to assess the speed of saccade, or it is not going to measure accurately the amplitude of saccade, but it is a very direct and immediate measurement. And this tabulates nicely what are the different methods of eye movement measurements. So earlier days, we had electrophysiological or even invasive methods of eye movement measurements, which is based on oculography or myography. And then we had indirect measurements where we used different different verbal responses or different uh, instructions with which the subjects moved their eyes. So these were visual search tasks. These were instruction-based tasks. Here again, there was much higher variance in terms of measurement, which led to use of current eye tracking systems, which are very objective. They are repeatable and very accurate. But these also come with a problem that they are very expensive. It requires more time. The measurement is actually very simple, but the analysis of this data is going to take much longer time, and it requires certain specific skill sets. And it is also very much affected by your head movement, which can affect the calibration. And finally, we have the direct clinical observations like the DEMS or the Enso. So moving into each of these methods. So the invasive methods, we have the scleral search coil magnetic field. So here you have a contact lens placed onto the eye, and then there is the change in the magnetic field, which is measured depending on the direction of eye movement. So this is going to give us results in terms of, what we see in ECG or EKG in terms of the magnetic field change when one makes an eye movement. And the second measurement is contact lens optical lever method. Here we have small contact lenses which have very small mirrors attached to it. And as the eye makes the movement, the angle of reflection from the mirror is measured. So instead of measuring the reflection from the eye, the reflection from the contact lens is measured. These are very invasive ones, and we don't use it anymore. We still use electrooculography in certain diseases, which measures the corneoretinal difference and potential, which happens during eye movements, again for light and dark conditions. Purkinje method or pupil glint method is the most commonly used ones. So this uses video oculography. These have setups like this, where small cameras are focused onto the pupil with LED systems, either visible light or light utilized from the environment. And a web camera based eye trackers are also video oculographic measurements. So we have cameras that essentially tracks the pupil or the reflection from the pupil or the cornea. The second one is infrared based eye tracker. So here we have an eye tracker over here while the subject is performing a task. So these are infrared eye trackers. So these are not going to have any direct reflections onto the pupil. So there is no problem in the subject performing a task. Right? We previously mentioned that for most of these measurements, we require a target property to measure the eye movement property or to even establish the eye movement property. So if we have an additional light setups like here, that could hinder the actual task performance. So what we have in later stages is infrared based eye trackers. So these have infrared lights to track the position of pupil using IR cameras, while the subject can perform the task without any disruption in their task performance. There are also very advanced methods, I would say more expensive methods, where the retinal vessels are tracked using scanning laser ophthalmoscopes to measure the saccade. So this is a much slower speed one. So we have the pupil tracking method, which has very good error rate and it has very good resolution. And then we have the retina based tracking one, where the error is much higher than the resolution. So retinal tracking is also not very commonly used for eye tracking, but you have a data where the patient is moving. Like for example, a patient has AMD, we are performing their fundus imaging and we have an option to record how their eye moves. Then these retinal based trackings can be used instead of the eye tracking systems. But this individually is not going to be a very viable option. Moving on to the clinical measurement of eye movements, there are several methods. I'm going to discuss just the two, which is very commonly used, the developmental eye movement test or DEM. So DEM has three cards. One is for vertical saccades, one is for two for vertical saccades and one for horizontal saccades. And with the DEMs, what we are looking for is the speed and accuracy with which these saccades are made. So this is a third type of card, which is for the horizontal saccade. Each line has 5 letters and we have a scoring card corresponding to this. As the subject reads each of these numbers, we take the total time required for reading all these and then the number of errors made, and we have an adjusted time and the vertical time. So when this is essentially for done for children. So it is studies show that in different countries, when you have different languages, the language is a huge influencer of these tests. So non-English speaking participants take a longer time to complete these tests when compared to English speaking participants, and children take much higher time to complete DEMS compared to young adults. The next one is the Enso code test, the North State and University College of Optometry oculomotor test. So this again looks for saccades and pursuits. Saccades, the test is pretty much like confrontation. We stand apart at a distance from at 1 meter distance from the patient. And then there are two different colored targets, pens or balls, or one of these targets. And then we ask the subject upon our instruction to look at one of the two colored pens. Here, explicitly, the subjects are asked. We don't instruct the subjects not to move their head or body because those are also taken into consideration in their scoring. So the ability to move correctly, how accurately they see, how many complete cycles they do, and how many times they move their head and body are all used in Enso. This is for saccades, and for pursuits, we have the subject following the target in both clockwise and anti-clockwise directions. So these are again not going to be very reliable in toddlers, primarily because of their difficulty in following the instructions. So NSUCO is scored based on these parameters. So the ability is whether they complete all the tasks. Accuracy is whether they are going beyond or undershooting or overshooting their eye movement compared to the target position. How often do they refixate, and are they making any gross movements or small movements or absolutely no movement for making these measurements. So higher the score, better is their eye movement performance. Okay, so we have several of these methods for measuring eye movements. Where are they used? They are again used in many places, but I'm going to give you just five essential ones. One in health industry. By health industry, majority of eye movement or eye tracking is done by psychologists. It's also done by neurologist and neuro-ophthalmologist, and then in vision science. So these are the three regions. Behavioral science, behavioral psychologists, neuro-ophthalmologist and neurologists, and then optometrists who essentially deal with traumatic injury or vision therapy. These are the regions where eye movements are used in terms of health sector. Then it is used in road safety. By road safety, it is not only to assess how the eye movement behavior varies among drivers or non-drivers, but there are also automotive companies which now use eye tracking in their dashboards or eye tracking technologies in their rear view mirrors, which constantly tracks the alertness of the patient by terms of measuring their eye movement and head movement. And these are going to give you signals while you feel sleepy, when you're not wearing your seatbelt. So these are one step ahead, and it helps in safe navigation in the road. The third one is sports and gaming. By measuring the eye movement, we have immersive gaming technologies, where the interface changes its position as the eye moves. And then we have second largest area, I would say, where eye tracking is used is in looking for marketing or user behavior, where to strategically place an advertisement or a point of interest in the website, or where to arrange objects. All these are analyzed. Market user behavior or marketing strategies are analyzed depending on the eye movement behavior of a subject. And finally, these are used in reading and education, where depending on the subjects, how they learn or how their pattern of reading is, certain training programs can be developed. So these are the five major areas where eye movement is used. So little bit of where eye movements are used in various systemic conditions. Mainly, the eye movements are measured and analyzed in neurological diseases or neuro-ophthalmological diseases. In Parkinson's and Alzheimer's disease, we have slower and inaccurate saccades. For Parkinson's, it's more of a pro-saccade rather than an anti-saccade, whereas in Alzheimer's, it's more of an anti-saccade saccades. And you have jerky pursuit movements where the tracking is not very smooth as compared to a healthy participant. So again, we can see here the rate of error in anti-saccades is much higher in a Alzheimer's patient compared to a normal subject here. Then in multiple sclerosis, this is something we know, right? Nystagmus is seen in patients with multiple sclerosis. So concurrently, they have difficulty in maintaining fixation as well as in tracking the object along the line. In ataxia conditions, again, because of the inherent muscular difficulty, the latencies are delayed for initiation of eye movement. So the latency as well as the acceleration is reduced. And these subjects also have difficulty or inability to maintain fixation for a longer duration. And for mostly subjects with traumatic brain injury, especially mild traumatic brain injury, vergence deficits are given. These patients have vergence deficits. Extreme cases can develop nystagmus, but many of them have pursuit initiation problems. So what we have here is a patient whose left and right eye image is given. If this is the target, the patient takes a much longer circuitry or much longer trajectory to attain this kind of a movement. We still see that the region of interest is achieved, but they have problems in exactly tracking the object. And finally, when we have a patient who has SNP, these saccades are slower, especially in the vertical gaze rather than the horizontal gaze. So these are some of the summaries where eye movements are affected in certain systemic conditions. And Huntington's disease, while reflex saccades are normally present, voluntary saccades are absent. And what about eye movements in ocular diseases? Again, I'm grouping them into gross conditions. When we have peripheral field defects, the saccadic latencies become longer and the amplitude becomes smaller. So we can see here the patient who has a POAG has much longer latency for saccades compared to their corresponding controls, and they have more errors compared to the corresponding controls for both static as well as moving target. They also have decreased inhibitory reflex, primarily because when the object goes from a seeing to non-seeing area, the subject is not able to judge where it goes, and the inhibitory reflex becomes decreased. And the optokinetic nystagmus is also abnormal for the same reason. For people who have central field defects, there is obvious issues of fixation instability. There is a reduced amplitude of eye movement, any of those eye movements, saccades or pursuits, and larger number of regressions. So this is true in case of any central field defect diseases like AMD or diabetic macular edema or myopic macular disease. We have problems in amplitude and stability of fixation. And in children who have amblyopia, it is found that the pursuit characteristics are more affected than saccades. Uh, and subjects who have amblyopia also have binocular dysconjugacy. That is the eye movement, if you measure individually for the right eye and the left eye, the correlation between these two measurements are going to be reduced compared to a normal subject. Okay, in alignment with this, eye movements are now thought or is being used more and more as ocular diagnostics. So one is for the very common one is for measurement of the visual fields. So eye movement perimetry is very common. Here, the extent of visual field is measured based on the eye movement the subject makes, and depending on the size and target for which the eye movements are made. And eye movements are used also in compensating the clarity or resolution of image, again in systems like SLOs or OCTs, which are still used in research laboratories, not very much in commercial ones. But eye movement compensation or eye movement artifact correction is now available in some of the commercial instruments also. So this is the effect. I hope it's visible well. What happens when an eye movement is corrected? It just essentially improves the resolution. So that's the application of eye movement in the field of eye health. Developmental disorders. Again, I'm going to talk about dyslexia, autism, and ADHD. in dyslexia, people who have learning disorders, longer fixations are seen, shorter saccades, and then there are more frequent regressions. When there is a predictive saccade, the latency is delayed. Again, binocular disconjugacy is observed. For children with ADHD, because of attentional deficits, there is problem in maintaining fixation. And these children also make larger premature saccades and uh, prosaccade conditions. In autism, because of the spectrum of the condition itself, the eye movement disorders are very atypical. But what is observed is a disconjugacy between the right and left hand. Eye movements in driving. One, I told you, in road safety, it is used for measuring, it's used for monitoring the behavior of the driver, the alertness of the driver. But eye movements are also used in driving behavior assessment. So these are examples where experienced users make faster circuits. Let me see. Okay, so here we can see on the right side is a experienced user. He makes larger span of movement for the same given timeline compared to a novice driver who makes a much shorter span. So their useful field of view is much limited in a novice driver when compared to an experienced driver. And these are also used to find gender differences. And in this one study, it was interesting to see that women had much smaller steering angle. So the steering angle indicates how much the eye deviates from the steering wheel on either side of it. So females had much smaller visual steering angle compared to males. And this was also significant, if I'm not wrong, indicating that women make much lesser have much lesser scanning behavior compared to males. So these kind of analysis can be made with eye movements, and training programs can be designed for specific deficits that are observed in driving behavior that can eventually improve the driving safety of these drivers on road. Um, in sports vision, sports vision is eye movement is used as more of a behavioral tool where the eye and head movements are made. So this one here is the uh, change in eye and head movement pattern of a batsman with respect to the ball time, and it can be seen that the gaze changes from the release of the ball. How does the head change and how does the corresponding eye movement changes? And again, these changes are different when you look at a professional sportsman versus a novice. So one line here is the arrow indicates where the ball pitches. That line indicates the target. The other line indicates how the eye movements are. And these small um, lines over here, the vertical lines over here, indicates the number of regressions. And we can very well see that an amateur cricketer makes much more regressions compared to a professional cricketer. So these kind of behavioral analysis, both in for sports vision as well as for sports psychologists, it is very useful and can help in improving the accuracy of their shots or thereby improving their sports performance. The second place where eye movements are used or to measure objectively the effect of training. So here this is an example I'm showing here where there were two groups. One to both the groups playing golf. So these are the pre-training scores and the post-training scores when there was only eye training. So simply they were asked to look at the target and hit the target. And secondly, when they were given technical assistance or technical coaching on how to play golf. And we can see that pre and post training, the total fixation time increased in the quiet training group, whereas it remained the same in the technical guidance group. So these kind of these kind of changes or objective measurements of how a sports vision training helps in terms of sports performance can also be done with eye movement tracking. Finally, reading is one area where eye movement is frequently used. So here the picture on the top shows what is the normal reading pattern when a normal person goes from one line to other, and the reading pattern or a common reading pattern of a dyslexic reader when they go from one line to other. And we can see here that a dyslexic child is making more number of corrective movements, or there are much more regressions as they go from one line to other. Overshoots are seen before they go for correction. Uh, so these kind of movements are observed. And again, in children, in these children, we can give specific training methods and see how the pattern whether the pattern starts resembling a normal reader. This table in the right side shows in AMD patients what happens when you give eye movement training. And again, in almost all the conditions, there was a significant improvement post-training when these specific eye movement trainings were given, whether they had to follow a dot, whether they followed a saccade, whether they followed, this is pro saccade task where they matched the letter and moved their eyes. So in almost all these conditions, a significant improvement was found in eye movement when AMD reading training was given. So one other application of eye movement here. And at SRM, we essentially do two types of eye movement research, one using the web-based eye tracking setup. The other one is we have a low-speed infrared-based eye tracker. So the next few slides are placed chronologically. So this was a undergraduate project where the students measured eye movements with different types of images for large and small screens. And this was, again, like I said, was a web-based eye tracking. What we looked for in this was their pattern of reading or their pattern of looking for a image. And so we looked at the area of interest and their root scans, scan paths. So what we see here is a text target and a picture target at the beginning of the task. In the large screen, this was how at the end of the task the patient had moved their eye to look at the different parts of the picture. Whereas here we can see that because it's a reading task, the subject had gone systematically and they have covered majority of the text to do the reading. This was for a large screen. When we look at a smaller screen, because the screen size itself is smaller, the change we can observe in, especially for a image target, from larger screen to smaller screen, the scanning was much more efficient and they could cover larger space in the 1 minute of span. Another another eye movement task we did was we looked at how the eye moves with with a blur that is similar to underwater. So this was based on IR tracking. The subject was looking at a target. They were looking um, at a task, which was essentially a fish moving underwater or a dot moving underwater in an underwater scenario. And it was the subjects viewed it through our tank setup. If you had listened to any of my previous talks on underwater or Vivek's talk, we would have seen the setup. So there was a huge tank. The tank was filled with water and it moved, and the subject had to track the object as the object moved across various directions, the cardinal directions. And what we found was the bottom two plots indicate the right eye and left eye plots for no blur setup, and we see nicely the subject is moving in the corresponding directions. However, when we look at the underwater, we find that one, there is more disconjugacy. This could be because the pattern of blur itself changes underwater. So the shift in the phase of the stimulus could be different. So it is one way of characterizing how the object moves. And we also find that it is more restricted underwater because by the time the target moves, because of the shift in the water position, the position of the object also changes. So more disconjugacy and less accurate tracking was observed underwater. We also looked at how the eye movements are in people with motion sickness when compared to normals. And essentially, we did not find any change. The idea behind this project was people who have motion sickness usually have an impaired vestibular reflex. So, but we did not measure the vestibular reflex. We just showed a moving stimulus, and we saw a very small non-significant changes in amplitude and velocity and a marginal increase in regression. We are not sure if we should have if these results would have been different if we had taken a different kind of target. So that is still a project which is chalked for future. This is again, I looking at eye movements in patients post-COVID. In COVID, this like when the time this study started, there were so many papers that came out with cognitive impairment post-COVID due to the short-term hypoxia the patients uh, apparently experienced during this. So this was for this we used a high frequency infrared based eye tracker, and we found that as expected there was a delay in latency of the anti-circuits in COVID patients compared to their age-matched normals, but the memory-guided circuits were normal. There were also higher errors in terms of directional errors in post-COVID patients compared to the normals, especially in the anti-circuit task than compared to memory-guided circuits. So even in patients who are normal, who don't exhibit any deficit in terms of cognition, we found these kind of delays and errors in post-COVID phase, immediate post-COVID phase. All of them had less than 1 year of post-COVID exposure. The last research which we did, okay, this reference is wrong. Here we looked at characterizing whether bifocals and progressive spectacle wearers truly have a difference in their eye movement behavior while they performed a reading task through measuring their eye movements. So here again, we use the low frequency infrared based eye tracker. We found that with progressives, there were faster saccades, but the regressions and amplitudes were quite similar. The amplitudes with progressive lenses and the amplitude of extent of eye movement with bifocals were similar. The number of regressions they made were similar, but saccadic velocity was much faster with progressives, probably because of the absence of these jump lines because of the bifocal segments. So the last ongoing one, which is the uh, PhD work of Mr. Prem Sudhakar. He's looking at the change in eye movement while training. So while training for drivers, and this is again based on web-based eye tracking. And on the left side here, we have a novice eye track, the driving behavior of a novice eye tracker. And we see that while they turn to the right or to the left, they are not looking at the rear view mirror. They have more fixations in their dashboard. Whereas when we look at a experienced driver here, we can see that as they turn, they look at the side view mirror while they make that turning, and much lesser or shorter fixations in the dashboard. So we are now looking at how these behaviors change, whether this person will start behaving more like this person once they get trained or once they drive for a longer duration. So that is the essence of eye movement research that is happening here. So in a summary, what eye movement does is it's an indirect measure of how coordinated the spatial vision in the eye is. It is an indirect measure of the vestibular ocular reflex. It's an indirect measure of cognition and attention. Um, it helps once we measure these aspects, it helps us in customizing strategies. For example, in a patient who have Parkinson's, a pursued training is going to help them train indirectly the centers for movement in the pontine nucleus. Likewise, it also helps one cope with different visual deficits, like subjects who have peripheral visual defects or central visual defects, how the eye movement training can help them in coping up with these deficits. The diagnostic value of eye movement measures per se is still largely questioned. It's very much like our VEP. Any of the optic nerve diseases are going to have a delayed latency. Whether the delayed latency corresponds to one disease or the other is not. There is no number that is going to separate this out. So most of the eye movement measurements or the terminologies we have mentioned earlier are also like that. What in my opinion, the future eye movement research or works are driving towards is looking at eye movements as disease biomarkers and in providing psychological insights. There are a number of studies currently where if we look at, they're looking at the behavior of adolescents um, compared to adolescents, helping us to see if they are developing anxiety disorders or if they are developing depression or stress. So these are used as eye movements are used as insights, and for biomarkers for cognitive impairments and neurological impairments. Eye movements are used more and more to estimate what cognitive load and attention the patient is having. And this again, in turn, helps us to have safety measures developed. And there are already commercial devices that are using eye movements to have an hands-free access for navigation as well as for security purposes. Uh, but what is also essential is from the measurement table, if you remember, we told that these clinical measures don't give us exactly what the eye trackers give. The invasive methods don't give us what the eye trackers give. There are web cameras which are cost effective but have um, certain calibration issues or errors in measurement. So what is essential is to develop cost-effective devices and open source softwares that can help in eye tracking, and using the various eye tracking data to come up with very concrete diagnostic criteria for different diseases or different uh, conditions of different ages or different conditions of measurement. So I think that is where we are headed to. And with that, I finish my presentation. Opi?
Thank you so much for the very comprehensive from basics to what is happening right now with respect to eye movement research. It was bit comprehensive and extensive as well. We have a good number of questions. I think some of them you had managed to express it, especially with respect to patients with ASD or any other autistic disorders. How well we can record the eye movements and what are the difficulties we are going to face. That's three, four questions together. I'm just giving it as a single question. Yeah.
Okay. So we have there are two problems when we measure eye movements in the autistic kids. One, we cannot expect them to follow instructions to have a eye tracker based measurements. It's going to have to be free viewing. There cannot be a target based measurement in these kids. Second, these children also exhibit erratic eye movements. So what is essential is we measure their eye movements in a free viewing task and compare it with a age-matched normal child, these kids do perform a free viewing task. They don't give eye contact, but if there is a task, most of them are able to complete it. Similar problems are found with DEMS as well as uh, in both horizontal and vertical saccades of DEM also. So we have to adapt our measurements to these kids. So I have seen, for example, in Dr. Valarmati's thesis, when she measures eye movements, instead of using the red and blue pens, whatever captures their attention, we can use modified targets to see whether they are performing the saccades. And in mild or moderate cases of these behavioral or developmental disorders, we do see that they're able to respond to it.
Okay. There are other questions as well. One from, I don't know, the guest name. How much do individual physiological differences, especially blink rate, pupil size, affect the interpretation with respect to eye movement data?
Yeah.
And what parameters we are supposed to take into control account while recording eye movements?
Okay. Eye movement recording, maybe that is one whole session in itself. But when we use these I assume she's asking for infrared based eye trackers. The most essential thing is to have a calibration done properly. Once the calibration is properly done, each machine or each setup has its own one. Even the webcam based eye tracking setups that I showed, they also have their own calibration. So once the calibration is done, the problems that we will have, blink data we will have to delete. The data corresponding to blink has to be deleted. Sometimes post blink, the patient is going to have a quick corrective uh, saccade made. Those informations should be documented separately, but has to be removed when you're calculating the amplitude or velocity. Secondly, large amount of these patients, we ask them not to move their head. So when we are measuring eye movement for target specific tasks, those tasks have to be very short, because the velocities we spoke or the corrections we are talking are in terms of milliseconds. So 1 or 2 minute task itself is going to generate 5,000 rows of data. So
Okay.
that, yeah.
Okay. Yeah, got it. So I think we have managed to address most of the questions. Due to the time aspect, I would like to thank Aiswaryah ma'am for the wonderful presentation. Before we close, I just posted the present like today's quiz link. Once you fill in this quiz link, you will be able to get OCA certification with 2 credit points. It is there in the chat box. So do fill it and submit so that you can get the certificate from duly signed by OCA and Acchutha. Thank you so much, Dr. Aiswaryah, and everyone for the good time.
Thank you. Thank you so much for the opportunity.
I'm going to stop recording. Thank you so much.